The COVID-19 virus is developing rapidly, and we talked to DHHS Secretary Mandy Cohen to get the latest. Secretary Cohen, thank you for visiting with us again. It's hard to believe, but 5 weeks ago we started these interviews. And on that Wednesday, we had 6 reported cases of coronavirus. And now here we are 5 weeks later with some 1,500 cases. We've had 10 consecutive days reporting 100 new cases or more. But some say we're still in the infancy of this thing. What do you think?
Well, first, Tom, thanks for having me and for getting good information out to folks. Yes, we know we're still in an upward swing of this virus. We're in more than 75 counties at this point, and I expect to see it in every part of North Carolina within the next few days or weeks. And that's why it's been so important that we've taken these early aggressive actions to try to slow the spread of this virus. We've closed schools early, closed restaurants and bars, closed the big mass gatherings. That was important. And now, as of Monday night of this week, it's stay at home. And so my message of the week is thank you for staying at home.
You left off wash your hands.
well, that's a given.
That's
our new normal. Washing your hands, new normal.
I'm sure you have too, but we've been watching all the various models that people are putting forth as to when North Carolina is going to reach its peak number of cases, how many deaths we're going to have. I was particularly interested in the University of Washington because they seem to be getting a fair amount of credibility among people. They put out a total on Sunday, then they came back on Monday and lowered those numbers. Why?
Well, look, there's a lot of models out there, and I recognize that in this time of great uncertainty, folks are looking to something that's a crystal ball, but models are not that. They're just based on assumptions of some scientists putting some numbers together, and what I think is important is that to know that there's a number of different models out there. All of them tell you that the kinds of things we're doing in terms of social distancing work, right?
I was going to say, wasn't this sort of a testimony to the fact that we are indeed flattening the curve a little bit?
That's right. I think these models are showing that if we do the hard work of this social distancing, and I know it's hard, and I'm so appreciative of everyone following the governor's orders to stay at home as much as humanly possible, that it works. It will slow the spread of this virus. But what we don't know yet is how much is it slowing the spread, and what does that really mean for North Carolina in terms of peak, how many people are going to get infected. We've been working with a team of scientists here in North Carolina, public and private, Duke, UNC, Blue Cross, Novasci, RTI, and we're trying to bring all the models that they can get their hands on together, right? Because I think that there's no one model that's going to be, like I said, the crystal ball here, but can it give us enough information to help us for here in North Carolina? So we're still trying, they're still working, they're not sleeping much these days to try to help us out. So they're still working on those models. Again, we looked at the data in terms of what's happening around the world, what's happening in hot spots around the United States to help us know that we needed to take early and aggressive action to slow the spread here, and we're gonna continue to learn more over the next number of weeks.
Dr. Tony Fauci, who is becoming sort of an authoritative voice,
absolutely,
and Dr. Deb Birx, authoritative voices in this, says that the actions that states like North Carolina took this week will save lives. He's very emphatic about it. But he also said communities need to have the willpower to flatten this curve and to reduce the number of cases. Some disagreed with your decision to stay home. How committed do you think North Carolina is to this directive?
Well, we've been very clear, and I thank Dr. Fauci, Dr. Birx, and others for continuing to articulate that social distancing saves lives. So staying home matters, staying home saves lives, which is why we're asking folks, unless you're going out to the grocery store or to pick up some medication at the pharmacy or to seek medical care, folks should be really staying at home. I want folks to be caring about their mental health. We know it's hard to do that. So, go out, take a walk outside, but then come home, wash your hands.
So everybody is calling this mitigation efforts, trying to flatten the curve, reduce the number. He says the next 30 days are going to be very important in the nation, and I assume in North Carolina too. How long do you anticipate this stay-home directive?
I think that's a really hard question to answer. I think we have to be looking at the numbers over the next number of weeks. How fast are the cases growing in North Carolina? How many hospitalizations do we see? Again, all of this effort is meant to slow the spread so fewer people get sick at the same time. What we want to make sure is that there's enough medical resources for those that need it. For COVID-19 or whatever, we knew that folks are still going to unfortunately have heart attacks or be in car accidents. We need our medical system to be there for them, and if we overrun it with COVID-19, not only will we see deaths from the virus itself, which we know in the best of circumstances, when people have access to ventilators, there are still deaths. God forbid we get to a place where we don't have those resources, we know death rate would go up even more. So that's what we're trying to prevent.
Are there specific numbers you're going to be looking at to decide when to relax the stay home?
Yeah, it will be a lot of different factors that we look at, and we're going to look at around the country in terms of folks that are a bit ahead of us in this, but we're going to look at the number of cases and how fast that's going up. We're going to look at our number of hospitalizations, and we're going to look at what we're able to do in terms of our surging capacity in our medical system, right? Because we're trying to both slow the spread and increase our medical capacity. But there's no perfect answer here, and I know folks want precision. They want to know what day, and I apologize that we're not going to get to that level of precision for folks and that exactness. Know that we're trying. Our scientists are going to do the best work that they can to give us the best idea, but it's like predicting the weather. We're probably going to be able to give probabilities. We think this probably will happen, but then we'll have to move through the reality of this new and uncertain circumstance and make adjustments as we go.
Like the fellow said, Lord, give me patience, and I want it right now.
And it is so hard. It is so hard. So hang with us and know that we have really smart people working on this, but we've never been through this.
And we got to do this together.
We've never been through this.
On Tuesday, you released some fascinating data, late Tuesday afternoon. I want to ask you some questions about it. Of the deaths that have been reported so far, most of the deaths were from men, and most of them came from people that were over 65 years of age. Now, the other side of that data shows that the number of cases in the age groups, the number of cases that are reported, only, 19% were people over 65. How do you coordinate those numbers?
Yeah, so it very much correlates to what we've been saying. Who is at high risk for severe reaction to this virus? It's people who are over the age of 65 and those with underlying medical conditions or a suppressed immune system. So if you look, unfortunately, at our deaths, you're going to see that be heavy in a population that is over 65 or who had chronic medical conditions.
So not as many older folks, and I fall in that category, are contracting the disease, but when they do, it is more serious.
That is right. And the reason why I think folks who are older are not contracting it, I think that they are recognizing their own risk. Very good job. Recognizing their own risk, staying at home and doing those things to protect themselves. I think some of the folks who are younger don't realize yet that they too play a huge role in this and helping us slow the spread.
But it was fascinating that 43% were between the ages of 25 and 49, and another 26% were between 50 and 64.
Yep.
This is not just an old folks disease.
Oh, it is not. So when we're talking about risk, it is risk of getting serious illness, but everyone is susceptible to this disease at any age, including children. We know that children can get COVID-19. We just know that they don't get serious reaction to it, which is good news as a parent of a 5 and an 8-year-old, happy to know that my kids won't get a serious reaction, but they still could catch it.
Part of your data that was fascinating showed that roughly 26% of all the cases come from Mecklenburg County, and half of the hospitalizations come from Mecklenburg County. Why there? Is it because of international flight travel or what?
Yes, I mean, those are our population centers. I don't think we're surprised to see more of our cases where there's more people and, of course, where there's an international airport and more mass transit. It's just where people are moving around and bumping into each other more. So we are definitely looking at our more populated areas. But what I would say to our folks in rural areas, yes, folks don't bump into each other quite as much because there's less folks, but that's where we also have less medical
Yeah, you said
resources.
last week if you're living in one of these counties, and I think there's some 28 counties or 18 counties that don't have an instance of it, it's coming.
It's probably already here, is my message. It hasn't shown up in the numbers yet, but my sense is it's already in all 100 counties here in North Carolina. Obviously, we are trying to move to testing folks who are ill in our hospitals, our healthcare workers, and others. And so we know we're needing new techniques to understand how the virus is spreading around North Carolina. But I think what we have shown is that we know the virus is here before it even shows up in our numbers. And that's my advice to everyone, which is take this very seriously.
Well, you were saying that 5 weeks ago.
And I don't want to say I told you so,
but you told us so.
But here we are, and we need to be staying at home and washing our hands.
Was there anything else about the data that was interesting to you as you looked at all of this?
I think what I see as I look at the data is right now, in this moment, we are not surging our medical we're not straining our medical capacity, and that is good. It means that the things that we're doing are right now slowing the spread of the virus. So I want to see more data to understand how slow is that spread, and we're going to be watching that very closely. But it's telling me we have medical capacity right now, and I want to keep it that way.
Well, let's transition to this. This is a great segue into talking about supplies, because throughout these 5 weeks you've been saying that you're keeping a close eye on our supplies, particularly PPE, face masks, gowns, gloves, ventilators. You reported 670 of our 2,500 ventilators in North Carolina are currently being used, not all because of coronavirus, but also that you've purchased a large number of ventilators. They just haven't been shipped here yet.
So what I would say about supplies is that, as you read in the news every day, that there are supply chain issues across the board, whether it's testing supplies, gowns and gloves and mask supplies, as well as ventilator. That is it. We have never experienced something like this global crisis all at the same time, where we are really struggling across the board. And we've never had a situation where we've had to make some of these hard decisions. Do we buy very expensive ventilators? Where do we need to put them?
Has price gouging been a problem?
We are definitely paying more for things like masks. I think and across the board. And I understand that, right? There's the supply is limited and the demand is great. I took a couple economics classes, but right, so I understand that. But we just know, I want folks in North Carolina to know that the governor, myself, Director Sprayberry are scouring the earth to bring resources here to North Carolina. But it is hard. But we are working hard 24 hours a day to try to make resources available here for us.
Let me expand on this hospital issue, because as I understand it, there's something like 21,000 hospital beds in North Carolina. 3,200 are intensive care ICU beds. Typically, hospitals run at about 85% capacity, with about 15% vacancy rate. Now we are told that it's around 60%. Are we going to have enough beds?
So a couple things. We've asked hospitals to cut down on some of their elective procedures, so we're intentionally asking them to run lower than at capacity. Plus, we know that we're asking patients to use telehealth and to connect with their doctors virtually instead of in person. So all of those things are reducing our census, reducing the number of people who are in our hospitals, and that's a good thing because we want it to be available in the case that we do see a surge, right? And so I thank my hospitals around the state that I know this is hard, right? Because they're running businesses.
Yeah, this is a two-pronged spear, because while they're doing this, they are also dramatically decreasing the amount of revenues that they have coming in to support their hospitals, and some of them, particularly in rural areas, are beginning to report some financial problems.
And we're trying to combat that. So the federal government's put out some new rules that in Medicare, if folks see Medicare patients, they can ask for advanced payments from Medicare. It's essentially no interest loans for folks. We're doing something similar on the Medicaid side, where folks can ask for some hardship payments that they pay back over time. And then we're also trying to to move forward some payments that Medicaid makes to hospitals. They make it later in the year. We're trying to move it earlier. Can we just help them with from a cash flow perspective? So we're trying to help on the financial side.
Yeah, because
so
we
that they
got
can
the stress
respond.
not only of having our hospitals and healthcare workers having the stress of dealing with the patients, but
Right.
now they're also dealing with the stress from the standpoint of finances.
Yep.
There's been a lot of question in the media about whether or not to wear masks. Now, most
Yep.
of us probably can't get hold of an N95 mask, but does it help, for instance, to use homemade masks?
I'm glad you brought up masks, a really important topic. So first, we need to make sure that we're saving those supplies for our frontline healthcare workers. And right now, that we are not in a place where I feel like we have excess supplies for our healthcare workers. We're able to fill what we need, but just for a short period of time, and then we get in more and we push more out to our healthcare workers. So I think having a conversation about is masks or are masks the appropriate thing to do going forward, I think that's a right conversation
But
to
are they
have.
beneficial
but
when I
not-
go out, you know, if I have to go to the grocery store, the drugstore, or whatever?
But I just want to make sure that folks know that at this moment in time when we don't have masks, we got to have those for our frontline healthcare workers.
Oh, sure.
Then if we look at the data, do masks work? I think the answer is it's mixed. You can't use masks without doing other of the good things we've been talking about, hand washing. So when someone wears a mask, they're actually more protecting the world from themselves, meaning that they are protecting the world from their droplets getting onto surfaces,
Not
which is
necessarily being
not
protected.
necessarily protecting themselves from the world.
Interesting.
But I think that also cuts down on the spread of the virus. So it's not like it's not useful. I just think we have to understand what purpose they serve. It's really more protecting the world from you as you go out, which is a good thing. If we all protect each other, that can be a good thing as we move forward. So you're going to hear more conversation about masks, and we're trying to understand
yes,
that.
they do. No, they don't.
Yeah, I just wanted to say, but today, as I sit here, April 1st, we need the masks for our healthcare workers. As we try to ramp up supplies and things like that, will our message be able to change about we should use masks or should we not? How should we use them in the safest way possible? I think you're going to see that conversation evolve as everything in this crisis is evolving.
On supplies, what are blood supplies like? I know that the Red Cross and other organizations have not been able to conduct the regular blood drives that they normally do. If I wish to donate blood, how's the best way to do it?
Yes, thank you for bringing that up. We do need folks to continue to donate blood, and I know the Red Cross has made a number of options available so folks can do it safely. So what I would say is go to the Red Cross or go to my Twitter feed because I've tweeted about the Red Cross options for you making appointments and doing that safely. We still need to keep up our blood supply.
Tell us your Twitter feed.
Oh, it's at Mandy Cohen So follow me on Twitter. We're putting out a lot of good information, or follow the Red Cross, and you can know how to sign up for places to donate blood. That's really important.
We're sort of in the frequently asked questions segment here, but another debate is if you have had coronavirus, COVID-19, you will be immune from contracting it again. Any evidence or data to prove that?
Yeah, so the evidence so far, yes, is saying once you've contracted COVID-19, you do have immunity. But what I would say is we do not have what's called an antibody test or a serology test that can confirm that yet. So I know that there are researchers around the country working on that now, but FDA has not approved an antibody test. But what we know so far is that we think if you get coronavirus, you will have immunity to it, which is a good thing. We want more people to start to become immune, right? That is good news, and the only other way you get immunity is from a vaccine. So that's the other thing that we want to make sure that folks are accelerating work on is a vaccine.
So if I've had it, could I go back to work?
That's right, and we have guidance about if you have COVID-19, how long you're supposed to wait in terms of your symptoms stopping before we feel like it's safe for you to say, yep, I'm good, I'm not going to spread virus anymore. And so those guidance are to say you want to at least 7 days, so at least 7 days or 7 days plus 3 days past when your symptoms end.
So you've said before that this is a respiratory problem as
It
much
is.
as anything
It's a
else.
lung problem,
So what
yep.
kind of long-term effects might somebody have who's had COVID-19?
Because it's so new, I don't think we know the answer to what long-term effects could there be here. What I would tell folks is that for those with underlying lung disease or any of our smokers out there, this is where you want to have your lungs be in the best shape possible before you get this. So I've been sharing that if you've ever been thinking about quitting smoking, there's never been a better time to get your lungs in the best health that they
Plenty of
possibly
incentive.
can. Exactly. I know it's hard, but lots of resources out there for folks to help them quit.
This pandemic has had an impact on everybody's life. It's changed lives in our state and in our country and in the world for that matter. But in addition to the obvious fiscal health issues, there are evidences of fear and depression and anger evidencing themselves. You alluded to that a few minutes ago. If I feel that I am having some emotional issues, what should I do?
Thank you for bringing this up, Tom, and it's so important. We're asking folks to do something that's very unnatural, stay isolated, and in a time of so much uncertainty and challenge. So we know that mental health is going to be strained for everybody. If you need help, please go to our website, dhhsnc.gov/coronavirus. There's a tab called Managing Your Health, and under there have some resources about how you can connect by phone to some behavioral health providers. They want to be there for help. Obviously, we always have our suicide hotline, but if you need...
So I could call a professional and get some help.
Absolutely, and we want you to do that. So please do take care of yourself. Make sure you're doing, good things like taking a walk, reaching out to friends by video conference or by phone, or then reaching out to some professionals that are out there who
this
want to
business
help.
of checking in with friends and neighbors is something that I don't know that we've emphasized enough. How you doing today?
I think that common neighborly checking in with each other is incredibly important. We got to pull together as a community here.
And I think one thing that our audience needs to understand is that while they are undergoing a tremendous amount of stress, our healthcare providers are also under huge stress because this is just relentless. It's never ending. And on top of all of that, particularly for primary care providers, they're seeing the revenues to their practices just drop off the cliff. At the same time, the demands are increasing.
Yeah. Give a virtual hug to your healthcare workers out there, the doctors, the nurses, the other clinicians. They're on the front lines of this. They are going to work gowning up, masking up every day to make sure that they can care for our friends and our families. It was Doctors' Day the other day. Shout out to my fellow doctors out there who are heroes in this. And I buy them some pizza. I saw that was happening in Mecklenburg where someone anonymously bought everyone pizza. You don't have to do that, but give them a virtual hug.
You mentioned telehealth. How well is North Carolina equipped to do this?
We have ramped that up extremely well. I'm really proud of where North Carolina is. I know so many doctors' offices have worked night and day to get that working in their practices. But what I would say is we still have the telephone. That's a good first step here. It doesn't always have to be video conferencing, but thank you to many of our payers for healthcare who immediately said we're going to pay the same that we pay on video conferencing that we're going to pay if you went in person.
Right.
The federal government, Medicare has done that as well. Medicaid is doing that. So we're really encouraging folks to take advantage of that.
Let's shift over to the future a little bit. We know what's going on right now, and you've been very helpful in helping explain that. Where do we go from here? What do you anticipate we're going to be facing in the next couple of weeks?
Yes, so I think that we're going to first really need to focus on stopping the spread of the virus, right, which is stay at home, all those activities around social distancing, and you're going to see us do more and more planning around surging our medical capacity. We also know there's a huge financial toll that's hitting folks, so we are focusing on efforts, whether it's expanding unemployment flexibilities or the stimulus that's coming from the federal government, or the fact that yesterday the governor signed an executive order around evictions and not turning
utilities.
not turning off utilities. So that's primary, like right now, and we're in it right this moment. And then it becomes like, what's next and what's
coming? Do you
coming?
anticipate this is going to probably decline this summer and then ramp back up again next fall?
I wish I had the crystal ball to tell us that. I would say I'm hoping for the best and planning for the worst. And so what I would say, I hope we see some seasonality with this virus, meaning that we see a decrease in it over the summer. I will say a bunch of my scientists here said, I don't know that we can bank on that. So we're not planning to see a decrease over the summer right now.
Got about a minute left. Any final words you want to deliver to the people of North Carolina?
Yes, so it is April 1st, and I want to remind folks that it is Census Day. And so I know we're all focused COVID-19 all the time, but please fill out your census, be counted. Census is such an important part of how we're going to get resources to North Carolina over the long term. And North Carolina is lagging behind some other states, and so we're competitive folks. We like to win, so I want to see us winning in our ability to respond to the census. So it's Census Day. Please fill out your census, and then take care of yourself. Make sure your chronic diseases are under control. Control your sugars. If you're diabetic, get your blood pressure under control. Go out and take a walk. Eat right, and then stay home. Wash your hands, and be patient with each other. Be kind out there.
You have been so good in communicating with the public of North Carolina, and we thank you and Governor Cooper and Mike Sprayberry, the whole emergency operations team, the healthcare providers. Thank you for visiting with us.
Thank you, Tom.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.